Hello, everyone, and welcome to this recorded webinar for the Medicare Ground Ambulance Data Collection System, or GADCS. Our focus today is on public safety organizations. I'm Andrew Mulcahy. I'll be presenting alongside my colleague, Sarah Hines. Take a minute just to comment on that term, public safety-based ground ambulance organizations, which is our focus today. That term refers broadly to ground ambulance organizations that are fire department-based, police department-based, or other public safety department-based organizations. An all hazards organization would also qualify under that umbrella term. This broad term, public safety, refers to organizations that do both ground ambulance and also some other important public safety function. There are some other types of organizations and other webinars that are available to ground ambulance organizations that have other kinds of shared services. For instance, a Medicare provider of service, that's a hospital or maybe also owns a skilled nursing facility or other facilities that also operates ground ambulances. You can find more information about some of those other shared services scenarios in our provider webinar and some other resources available online. But the focus of today are these public safety organizations that are fire, police, or other public safety department based. Before we dive in to the core of this public safety webinar, I'd like to point out the wealth of resources and information available not just about public safety-based organizations, but more broadly on Medicare's GADCS website. The URL for that website is below the first blue box on the screen. If you go to that link, you'll find printable versions of all of the GADCS questions in English and Spanish, a user guide helping you navigate the actual web-based GADCS, a FAQ document, a quick reference guide to get started, along with a range of other tip sheets and recordings, including one video walkthrough of the entire GADCS that you can navigate using chapters to go from section to section. So if today's briefing doesn't cover the questions you have on public safety-based organizations, I'd encourage you to check out some of these other resources. And one of the principles of the GADCS is that there are a couple initial questions in section 2, which covers organizational characteristics, that really help determine the specific questions you're going to see for your organization in later GADCS sections. The goal was to have the GADCS questions adapt so that you're not faced with answering questions that aren't relevant to your ground ambulance organization. And so we'll start off talking a little bit about section 2, where you, for the very first time, indicate that your ground ambulance organization is fire, police, or other public safety based. And then all of these other sections, section 5, 7, 8, 9, 10, 11, and 13, all of which have changes to the questions you're asked or the wording of the questions to reflect a distinction between organizations that are and aren't public safety based. Remind that everyone that selected organizations must complete the entire GADCS instrument, all 13 sections, not just the ones that we have listed on the slide up above. And there are a couple sections like sections 3, 4, 6, and 12, which are exactly the same for organizations, whether or not you're public safety based or not. One general instruction, a tip that applies across all of the GADCS, is that you need to report information in such a way that CMS can differentiate between expenses or revenue or utilization from your ground ambulance operation versus any other kind of public safety or other operations that you have. So there's generally two ways to do this, and the instructions allow for both in the GADCS. In many cases, you'll report a total amount for your organization, and then a percentage, a share of that that's applicable to ground ambulance operations and not, say, your fire department or police department. That kind of approach is called allocation. And there are separate resources, including a tip sheet, to help you think through what alternatives your organization has to do that kind of allocation. The instructions also allow you to do the math yourself. Start off with the total expense or revenue amount, multiply out by the share that you think is attributable to ground ambulance operations, and then just report that dollar amount as an amount that's entirely related to ground ambulance operations. Different organizations have different approaches and strategies to do this. And you do have a choice of, in many places, reporting it in one way or the other, either an organization-wide total with a share that's ground ambulance related, or just the ground ambulance dollar amount after doing that multiplication on your end. So again, if you're thinking about alternative ways to tackle this or need some advice or pointers, you can definitely take a look at the earlier allocation webinar and the allocation tip sheet. There are a couple of questions in section 7 we'll cover later that ask specifically about the hours worked related to fire, police, or other public safety operations. We'll cover these a little bit later. It's one of the few places where you're going to enter information that's specifically about your, say, fire department labor. In most other cases, you're just reporting the information about your ground ambulance activity. But in section 7, it is a little different than in many of the other GADCS sections. One last general pointer here is that for public safety-based organizations, there might be some staff or facilities, vehicles, or equipment that only have a fire, police, or other public safety role and not a ground ambulance role. Say expenses related to a fire training facility, or manager overseeing only the fire aspects of your operation, or equipment only used in terms of responses to fires. Those items across all those categories, staff, facilities, vehicles, equipment, are simply excluded from the GADCS. The requirement for GADCS and for Medicare to collect this information is very clear that it must focus on ground ambulance expenses and revenue and utilization. And so it is important to make sure that expenses and other information that's not in any way related to ground ambulance is excluded. And as we discussed a second ago around allocation, in cases where expense or other input into your organization is shared, partially ground ambulance and partially something else, you'll need to split it up. Let's move into our first question. These are actual screenshots from the web-based GADCS. So if you log into the system and link to your NPI, this is what you'd see. In section 2, question 7 asks the first of a series of questions that helps the GADCS understand which kinds of questions to ask your organization later on as you proceed through the other sections. Section 7 just plainly asks, which category best describes your ground ambulance operation? And you have a couple options, including fire department based, police or other public safety department based, and so on. Those first two are the two responses that will flag your organization as a public safety organization for the purposes of later sections. So if you report that you're a government standalone EMS agency, a hospital or other Medicare provider of services, or an independent proprietary organization doing mostly EMS or non-emergency services, those situations you will not see instructions and questions related to public safety organizations. So one way to make sure your organization's seeing those public safety questions later on is to ensure you're checking off one of these two first options in section 2, question 7. Should note this is your best interpretation of your organization. Some organizations are on the fence between going one way or the other on some of these categories. Just use your best judgment to pick the response that best describes your organization. If you need to, as a last resort, there is a write-in other field on the bottom. So moving on to question 8, there are these series of 3 questions to help cover the many different organizational relationships and functions out there in the ground ambulance industry. Question 8 asks you to refer back to your answer in question 7. So let's say you selected that you were fire department based. And this is a confirmation question to ask whether your ground ambulance operation shared operational costs, such as building space or personnel, with, in this case, a fire department. And that text would change to reflect your response to question 7. If you answer yes, then that's a signal to the GADCS that you are truly a shared service type organization where your costs will need to be broken out in some cases between ground ambulance and, say, fire activities. If you answer no, there are some situations where for historical reasons or just different accounting practices, there is a very careful distinction between a ground ambulance component of an organization and a fire, police, or other public safety portion of an organization. If that's true, and you're going to be reporting information that preserves that firewall between the 2 pieces, even though organizationally you might in some ways think of yourself as a combined ambulance fire organization, you can click costs were not shared as the second option in question 8. So most organizations that are fire, police, or other public safety based will click yes. Some, if you've gotten advice from CMS or following the instructions, you think this costs were not shared option applies to you, you can click that. Usually happens again when there is completely separate accounting and completely separate personnel, even though you might say share a name with fire department. And the final of these 3 questions in section 2 is section 2, question 9. So question 7, you get to pick one option of what best describes your organization. Question 8, you're referring to whether or not that other organization you share costs with. And question 9 gives you an opportunity to tell CMS about some more complicated arrangements. And sometimes you may want to check off a couple of options. Maybe you have for one interesting historical reason or another, you also have an air ambulance operation within your organization, or other healthcare delivery operations, such as a clinic or urgent care center that's not technically a Medicare provider of services, so you wouldn't have selected that option back in question 7, but you'd still like to report it here. So this is another opportunity for you to refine the way you're reporting how you think of your organization to CMS. This is an option where you can check all that you'd like to apply. Importantly, the option you did select back in question 7 will not appear in question 9. So if in question 7 you said we're fire department based, then this first question 9 option would actually not appear because you've already answered that back in section 7 that you were fire department based. But it would give you an opportunity here in question 9 to select any other that apply. So collectively, those 3 questions convey a lot of information to CMS. It's very important to think through those responses to the 3 questions. And based on those responses, you'll see different sets of instructions and questions later on. One final note, there was a change in recent rounds of rulemaking from CMS where there are some refinements to how your responses to section 2, questions 7, 8, and 9 lead to different instructions popping up later on. More specifically, there for organizations that select a hospital or other Medicare provider of services here in question 9 or back in question 7, those organizations would sometimes see still questions about fire, police, and other public safety labor. That has now been resolved, and CMS maintains a list of those kinds of clarifications and changes up on their website. So with that walkthrough of the key Section 2 questions, I'll turn it on over to Sarah.
Thanks, Andrew. On this slide, we discuss Section 5, which asks several questions about service volume. These questions will ask you for your organization's total responses, which are the number of responses by your organization for any reason, regardless of whether a ground ambulance was deployed. Responses to police or fire calls for service, for example, would be included in this number. This section also asks about ground ambulance responses, ground ambulance transports, and paid ground ambulance transports. These questions will be answered the same for both public safety and non-public safety organizations. Moving on to the next slide, we give an example of how a hypothetical fire department-based organization might respond to questions in Section 5. Please keep in mind that this and all other examples we present today are for illustrative purposes only and do not reflect any actual ground ambulance organization. Section 5, question 1 asks for your organization's total responses, including responses with and without a ground ambulance. This hypothetical organization had 300 responses where only a fire truck was deployed, 350 responses where both an ambulance and fire truck were deployed, and 350 responses where just an ambulance was deployed. For public safety-based organizations, this is one important place in the instrument where you'll count all your responses, not just ground ambulance responses. The organization reports a total of 1,000 responses, which includes the 300 responses where only a fire truck was deployed. Keep in mind that if more than one vehicle is sent to the scene, such as a fire truck and an ambulance or 2 ambulances, it still counts as one response. Beyond question 1, reporting in Section 5 is similar for public safety and non-public safety-based organizations. In the second bar, we look at ground ambulance responses, where we only count responses by a fully equipped and staffed ground ambulance. You can see that the organization did not count the fire truck only responses here, but they did count all the responses where a ground ambulance responded alone or in combination with a fire truck. Note that it is likely that not all of the organization's ground ambulance responses will result in a transport. The third and fourth bars illustrate the number of ground ambulance transports, 400 for this organization. Keep in mind that one response may sometimes result in multiple transports. In these instances, be sure to report all resulting transports in your total, regardless of the number of responses. The final column reports the number of ground ambulance transports from the third column, which were paid by the time the data was reported, which for this organization was 350 out of the 400 total transports. This slide gives an overview of Section 7 on labor costs. Here, you will need to collect and report on the different items listed by labor category for individuals with any ground ambulance responsibilities. So, anyone related solely to the fire or other public safety aspect of your organization would not be counted in this section. But anyone with both ground ambulance and public safety or ground ambulance only responses should be counted in this section. Moving on to the next slide. As a reminder, we will only highlight aspects of this specific section specific to public safety organizations. For a broader overview of the labor section, see our labor-specific presentation at CMS's Ambulance Events website that was shown on the third slide. In general, reporting staffing and labor costs is similar for organizations that are and are not public safety based. The main difference is that organizations that are public safety based must report staffing and labor costs separately for staff that do and do not have public safety responsibilities. We will give some examples in later slides. Slide 13 gives you an overview of staff categories. For each staff category, you will report whether you had any staff across the 4 categories: paid or volunteer staff without public safety roles, and paid or volunteer staff with public safety roles. You may select multiple options for each staff category. So, for example, if you have volunteer EMTs with no public safety duties and paid firefighter/EMT basics, you would check both volunteer staff without public safety role and paid staff with public safety role in that EMT basic role row. On this slide, we give an example of how a fire department-based organization would decide which staff have public safety roles. In the first example, the volunteer EMT basic only responds to ground ambulance calls, never fire or other public safety type of calls. However, the EMT occasionally assists with administrative duties for the organization. In this case, the organization elected to choose the relevant without public safety role because they did not have a public safety response role. However, if you think an EMT contributes meaningfully to administrative activities for the public safety aspects of your organization, you can use your judgment and choose the relevant EMT with fire, police, or public safety role option. Note that it is important that each staff member is assigned to just one labor category for the purposes of reporting throughout Section 7, even if they perform multiple roles in your organization. The next 2 examples are more straightforward. A paid EMT intermediate and a paid medical director who have ground ambulance responsibilities would be classified as paid employees with public safety roles. The next example is paid administrative staff that work with all aspects of the organization. Unlike the previous volunteer EMT basic example, you would always choose the relevant with public safety role option because their main job, administrative work, involves both ground ambulance and public safety activities. The next example of a firefighter/paramedic who responds to both fires and ground ambulance calls is also straightforward. The staff member would be classified as a paramedic with public safety role. Finally, the last staff member, a firefighter with no ground ambulance responsibilities, should not be reported anywhere in the GADCS. This slide gives an overview of sections 7.1 through section 7.3. Briefly, in these sections, you will be asked to report on paid EMT response staff, paid administrative and facility staff, and volunteer staff. For each staff category, you'll be asked to report total annual compensation for the paid staff categories, hours related to ground ambulance operations, hours related to public safety operations, and hours worked related to all other responsibilities. This slide shows which types of responsibilities fall into each category. Total hours worked annually includes hours worked on all activities at your organization, including ground ambulance activities, public safety activities, and other activities with just a few exceptions. Separately, you'll report hours worked unrelated to both ground ambulance and public safety activities. These hours might reflect work related to air ambulance, healthcare delivery, unrelated to ground ambulance, or community outreach. Time spent on call or fundraising should not be included in total hours worked. Slide 17 gives examples of how a hypothetical fire department-based organization might respond to question 1 in section 7.1. In this section, we consider only paid EMT or response staff. The organization has 2 paid full-time basic level EMTs without a public safety role. Both worked full-time or 2,080 hours during the reporting period, and each have an annual salary and benefits totaling $35,000 a year. These staff primarily responded to ground ambulance calls for service. They each spent about 40 hours a year doing public health and community outreach activities. For these staff, the organization reports $70,000 in total annual compensation, which is $35,000 times 2. They report 4,080 total hours worked, which is 2,080 times 2 minus the combined 80 hours per year doing public health and community outreach activities. Those 80 hours are instead reported in the rightmost column on total hours worked annually related to all other responsibilities. As you can see, the total hours worked annually for paid EMT response staff is grayed out. That is because the values in this column are auto-populated based on the numbers you input into columns to the right. And this serves as a check on the total hours worked. So in this case, the organization confirms that the 4,160 hours is equal to 2,080 times 2, which is the total numbers of hours worked by 2 EMT basics. This organization also has a paid paramedic/firefighter who's categorized as an EMT paramedic with a public safety role. She receives total compensation of $45,000, including salary and benefits, and worked 2,080 hours during the year. This employee spent all of her time either responding to ground ambulance or fire calls for service. The organization estimates that she spent equal time doing fire and ground ambulance responses, so half of her total hours, or 1,040, are attributed to ground ambulance operations and half are attributed to public safety operations. She has no duties that are unrelated to the organization's ground ambulance or public safety operations, so a 0 is listed in that column. I will now pass the presentation back over to Andrew, who will discuss sections 8 through 10 of the GADCS.
Thanks, Sarah. We'll wrap up our walkthrough of sections 8 through 10 here. These sections cover information about facilities and vehicles. As I mentioned in my introductory comments, so start of the call, be sure only to report facilities in section 8 and vehicles in section 9 that are fully or partially related to your ground ambulance operations. So if there's a facility that only is involved in fire operations, you don't need to report it in the GADCS at all. Overall, the facilities that you report in section 8 could include dispatch or call centers, vehicle storage, administrative offices, buildings for EMT response staff, or any other building that's fully or partially related to your ground ambulance operation. In question 2 of section 8.1, you'll list the name and function of each facility that's fully or partially related to your ground ambulance operation. So again, a garage solely for police cars would not be listed here if you're a police and ambulance operation. But a garage that contains fire trucks and ambulances would be listed here. And for each of the facilities you list in question 2, you'll give the total square footage of the facility. And then importantly, for public safety-based organizations, the percentage of that facility square footage related to ground ambulance services. CMS understands that folks may not be able to go out with a tape measure and estimate, very accurately measure and estimate area. You do need to report a specific number of square feet and a specific percentage. In some cases, this is going to come down to how you conceptually think about that difference between the determination between what's ground ambulance related and what's fire, police, or other public safety related. There are some cases in some organizations where just looking at physical space makes sense. So if it's a garage, you could think about the space used by ambulances versus fire trucks, say, as a way to ballpark the share of the square footage that's related to your ground ambulance operation. Just as an example of that, on the left-hand side here for facility 1, you could have a rough estimate of the share of square footage that your ambulances take up in a garage versus your fire trucks. Things can get more complicated than that. So in a case where maybe fire trucks also go out on medical calls, you could think about the split of calls that end up being ambulance versus non-ambulance related, or some other distinction to try to take a portion of the fire truck-based square footage here and categorize that as a related ground ambulance expense to include in the GADCS. For an administrative building, You might have a staff break room, a conference room, and offices. And let's say all of that space is used jointly by your firefighter EMTs, say. And if you look at your distribution of responses from medical versus fire, let's say it was 70-30. So it would be a reasonable and data-driven approach to report 70% of that total square footage as being related to ground ambulance services, even though those shared staff do use the entire facility. And again, it's important to break this up so that CMS and those using the GIDCS data down the road have a clear way to separate out the ground ambulance versus non-ground ambulance expenses. Moving on to section 8.3. This is a section for facilities that covers insurance, maintenance, utilities, and taxes. These questions in section 8.3 are different than earlier facilities questions where you were answering facility by facility. For section 8.3, you're reporting across all of your facilities combined. So a single insurance cost, a single utilities cost, say. There are opportunities in the tables in section 8.3 to report a share of the expenses you report there for these facilities related expenditures that are associated with your ground ambulance services. So as in many other places with allocation, you have a choice of doing allocation in a way that makes sense to you based on information available to your organization. You could split up utilities or insurance costs based on space or the share of responses that are ground ambulance responses. Or if you have another approach, preferably one anchored in something you can measure, you can use that too. So just as an example, let's say we have a organization with a garage and an administrative building, both of which are owned. The garage is 2,000 square feet. The administrative building is 1,500 square feet. And based on the space used by ambulances, let's say that the organization puts in an allocation factor of 25% here. And then based on a different factor, the share of responses that were medical versus fire, for this administrative building used across the whole organization, let's say they put in 75%. So this is a complete response to one of those earlier questions in section 8.1. This breaks it out for facility 1, there's a clear share. Facility 2, there's a clear share. For some of the questions in 8.3 where everything's added together, it's important to come up with a share that is consistent with what you reported earlier. This can take a little math, and we've walked through this example here. Let's say for total facilities related insurance, the expense was $10,000. Well, what number should you put in for the share there across all of your facilities? Just reported two different shares up here, but in section 8.3, you can only report one percentage. And so you can basically take the sum of all the square footage that in total, the sum of all the square footage after you've multiplied out these allocation factors, and divide the latter by the former, as we've written out here in the box, and get your 44%, which is the appropriate share overall across both of these facilities. Section 9 asks many of the same questions in section 8, but instead of dealing with facilities, we're now dealing with vehicles. So there are a couple of parallel sections in 8 and 9. 9.1 asks about ground ambulance vehicles. 9.2 asks about non-ground ambulance vehicles. And then just like in section 8, there's a section 9.3 that asks collectively across all of your vehicles information on certain costs like fees, insurance, maintenance, and fuel. So for section 9.2, where there's a question about other vehicle costs that are non-ambulance vehicle costs, it's important to note that you can report vehicles here like fire trucks or supervisor vehicles or quick response vehicles. All of those kinds of vehicles, again, if they are not related to your ambulance operation, they should not be included. If they are, you'll need to report a share of that vehicle's expense that's related to ground ambulance services. And then in section 9.3, you'll report some of these collective costs, like for fuel or maintenance, across all of your vehicles. Here, all of your non-ambulance vehicles. An example of section 9.2, question 5. Let's say we have 3 non-ambulance vehicles. Those vehicles are used both to support ground ambulance and non-ground ambulance operations. You don't necessarily track miles for ground ambulance calls versus fire calls, which might be the easiest way to split this up. But you do have this share of medical calls versus fire calls. And let's say that 15% of the calls that fire trucks go out are EMS related, and 50% of the fly car calls are EMS related. So if you have this information you've tracked, your organization may well have different information. You can go down and enter this in vehicle by vehicle to get a sense for the allocation factor for fire truck 1, fire truck 2, and then an other response vehicle, which here is marked as a fly car. I won't spend much time on section 9.3 because many of the considerations here are shared with section 8.3 on facilities. Here, you're going to report information about total maintenance and total fuel costs across all of your vehicles, ambulance and non-ambulance, used to respond to ambulance calls or support ground ambulance operations. There's specific questions that ask you to break out the approximate share of maintenance and fuel costs across these different types of organizations. Your ambulances or fire trucks might eat up a lot more gas than an SUV, say. So this is an opportunity to put in a breakdown of some of these vehicle-wide across all vehicle expenses to reflect your experience and information you're collecting at your organization on where those costs accrue. Moving into section 10, you'll be asked to report information on equipment and consumables and supplies. Now, many of these types of equipment, consumables, and supply may be specific to your ambulance operation, say equipment on an ambulance or supplies used in the course of providing care to patients. Some other expenses, though, like uniforms, for instance, for your firefighter EMTs, may have some shared expense component, or some of your capital equipment, say office facilities and furniture or IT systems. So for those questions, as in many other places in the GADCS, you'll have an opportunity to report a share, a percentage of these costs attributable to ground ambulance operations. As I mentioned before, much of the medical equipment, medications, medical supplies, medical consumables are likely going to be 100% related to your ground ambulance services. Here's a slide 28, that goes through some common categories along with examples and the common allocation approach here. So you can see capital medical equipment, medications, and other medical consumables are likely going to be 100% ground ambulance related. But some of these other categories, as I mentioned, will be likely less than 100% for public safety-based organizations. Just as a quick example, you might have this layout for an organization with $5,000 in capital medical equipment, which is 100% related to ground ambulance operations, 10,000 and 8,000 for medications and other medical equipment, supplies, and consumables, both of which would be 100% related. And then for uniforms, say that is 100% related for EMTs. In this case, there are a mix of 10 EMTs and 10 firefighters. So if you're reporting the $300 for uniforms just for the EMTs, that amount is reported in full as related to ground ambulance. But for some of these other expenses, like capital non-medical equipment and non-medical supplies, This organization might use the share of ground ambulance responses as the basis for allocating the total expense. And here, that share of medical to total responses is 80%. And so they report the full amount for their organization across ground ambulance and non-ground ambulance applications, and then put in 80%. We have other examples in different GADCS resources and up on the slide. Now, other ways to think about the split for things like uniform costs using different approaches. I won't go through these in detail. Suffice to say, the GADCS instructions give you flexibility to use a variety of different allocation approaches. And we encourage you to take a look at the allocation webinar and tip sheet for more examples. So with that, I will turn it over to Sarah to go through the final few sections, sections 11 and 13, with that public safety organization lens.
Thanks, Andrew. On this slide, we move on to reporting for section 11 on other costs. Just like the previous section, your organization will report total costs for the services that are either partially or fully related to ground ambulance services, and the share of those costs that are related to ground ambulance operations. The first question in this section asks you to report any contracted service costs that you did not previously report in the labor section or anywhere else in the data collection instrument. For each contracted service that you check off, you will need to input the total cost for the service and the percentage of the cost which is attributable to ground ambulance services. As you can see, you can only input costs and percentages for contracted services that you check off that you have. The cost and percentage box for services that you don't indicate you have are grayed out. This slide shows a hypothetical fire-based organization would report for section 11, question 1. This organization uses contracted services for billing, vehicle maintenance, dispatch, and IT support. The organization checks off that they contracted billing service, a vehicle maintenance service, a dispatch call center service, and an IT support service. Because they do not bill for fire calls, their billing service is only applicable to their ground ambulance operations. Thus, they report 100% for this item. The organization has a separate maintenance contract for ground ambulances. Therefore, they only report ground ambulance repair costs at 100%. The organization also does not include vehicle repair costs that they already reported in section 9 on vehicles in this question. Since IT and dispatch are shared with the fire department and there is no easy way to divide up these costs, the organization reports the percent of these costs attributable to ground ambulance services based on the proportion of EMS to total responses. Because 70% of their calls are EMS and 30% are fire calls, they input 70% into the rows for dispatch and IT support service. On this slide, we move on to questions 3 and 4 in section 11. In question 3, you will be asked to indicate whether you have costs for items and categories on medical or ambulance-related expenses, administrative and general expenses, and fees, fines, and taxes. Then in question 4, for each cost that your organization indicated that they had in question 3, you will be asked to provide the total expense for that category and the percentage of that expense attributable to ground ambulance services. This slide shows an example response for section 11, question 4. This police-based organization only had 2 additional costs not reported elsewhere: organizational dues and event costs. The organization paid $30 in dues to an ambulance professional organization. These are considered 100% related to ground ambulance services. They also paid $60 in dues to a law enforcement professional organization, but they don't report that cost because it is not considered ground ambulance related. The organization also paid $4,000 in event costs. One of the events was fully related to ground ambulance services, while the other event was only partially related.
The organization allocates the full cost of the first event to ground ambulance services and a portion of the cost of the second event, using the proportion of responses that were ground ambulance responses. And overall reports that 81% of the event costs were attributable to ground ambulance services. You can see the calculation in the gray box in the middle and the numbers that the organization reported in the screenshot at the bottom of the slide. This slide shows a different example. This fire-based organization has two other costs: biohazard waste removal and toll fees. The biohazard waste removal only applies to the ground ambulance services, so the total cost is reported with 100% of this cost attributable to ground ambulance services. The cost for toll fees is shared with fire services. While the organization doesn't have any way of separating tolls for fire versus ground ambulances, they do track miles for fire-related calls and for EMS calls and schedule ground ambulance transports. Since 78% of the miles traveled are EMS related or for scheduled ground ambulance transports, they estimate that 78% of the toll costs are ground ambulance related. We now turn to section 13. This section asks your organization to report revenues. In general, ground ambulance revenues are reported similarly across public safety and other types of organizations. However, some of the questions in this section do ask you to report the percent of the revenue category attributable to ground ambulance services using the method of your choosing. So we will address these questions in more detail. We now discuss section 13, question 5. This question asks organizations to report revenue from a variety of sources, such as contracts with other organizations, donations, or grants. Your organization will only have to report revenues for the categories that are applicable to your organization. For each revenue category that your organization has, you will be asked to report the total revenue and the percent attributable to ground ambulance services. This slide shows an example of revenue reporting for a fire-based organization. This organization reports 4 sources of revenues. One source of revenues is from providing standby support for sporting events. The organization sent 1 ambulance to each event and received $100 per event. The second source of revenue is from providing standby support for fireworks display. The organization deployed 1 fire truck and 1 ambulance and received $200 for this event. They received $500 across all 4 events. Since 4 out of the 5 total vehicles deployed at the events were ground ambulances, they reported that 80% of the revenue was ground ambulance related. The third source of revenue was a charitable donation specifically to implement an EMT training program. This could be considered 100% ground ambulance related. Finally, it received $100,000 in local tax support. $20,000 of this tax support, or 20%, was used to support ground ambulance services. Please note that you should report the actual ground ambulance related outlays from general tax revenue here, even if they were not initially earmarked for ground ambulance purposes. That brings us to the end of our presentation for reporting for public safety based organizations. Thank you.